morning, everyone. So we are going to be continuing with our programming. This morning is all about NCDs, and I'm delighted to be opening up this session, Scaling Up Oral Health Strategies for NCD Prevention in partnership with Haleon. I'm Kate Warren, Executive Vice President, Executive Editor at Devex, and so we're delighted to be partnering on this really important conversation today as part of the overall fight for NCD prevention. So oral health affects nearly half of the population and yet remains at the margins of health policy and funding. And even as the WHO has laid out a bold 2030 action plan and countries adopted the Bangkok Declaration, oral health was not included in this recent zero draft of the NCD declaration for the UN high-level meeting. And so that's why we're here today, because we would like to see that included. And this is why this conversation is so important. So we have a great lineup. We're going to start with a fireside chat, and then we will have a panel discussion and really talking about how through cross-sector collaboration, we can drive progress on including oral health as an important part of NCD prevention. I would love to get started by welcoming my first two speakers to the stage. We have Dr. Stephen Mason, Medical Lead for Oral Health for Haleon. Come here. And Greg Perry, Director General for Global Self Care Federation. Don't be shy. I don't bite. So, Stephen, I want to start with you. As mentioned, oral diseases affect half the population. They're also largely preventable. 3.7 billion people globally are affected. So they are easily preventable. What needs to happen to accelerate that prevention? And what role can a company like yours play in that process?
Well, thank you, Kate. And yes, we're here to shine a light on the critical issue that you've just outlined there. And the WHO slogan that there's no health without oral health. And that's a fundamental truth that society cannot ignore and should not forget. And we're here to talk about NCDs and the bidirectional links of oral health with other non-communicable diseases such as diabetes and perhaps even cardiovascular are becoming clearer every year. But as you mentioned, the global burden of disease studies estimates show that the prevalence of oral diseases is not declining and in fact is increasing. So we need to focus more on self-care for prevention. And the WHO best buy is the twice daily toothbrushing with a quality fluoride toothpaste. And yet, despite that, and despite the knowledge of the population that that's what they should do, we believe that 60%, only 60% perhaps of the population of the adults over 18 actually practice that basic self-care habit. And if that's correct, then it's not surprising that the global burden of oral diseases is increasing. So what can Haleon do? Well, clearly we advertise and promote our toothpaste products, but we can support the global coalition of oral health that is being created in its 4 work streams. We can support the advocacy and communication group, and we already provide arm's length support to the World Dental Federation Vision 2030 group, to the Platform for Better Oral Health Europe. And we partner within non-state actors such as the European Federation of Periodontology to produce some economic estimates together with economist impact on the importance of oral health. And we partner with our industry business association, the Global Self-Care Federation, to raise the importance of self-care or preventative care amongst the population. And I think that is one of the key things we need to do. We need to find the hook, the key that will unlock the preventative strategies in oral health, because the scale of the problem is so massive. As you said, more people have oral disease. More people have oral disease than all the other NCDs combined. And the economic costs of poor oral health, both the direct costs to the government and the taxpayer, and the indirect costs to the population are massive and unnecessary. So, you know, we really do need to push that. And the WHO goal of its Best Buy, that oral disease prevention can be through effective twice daily toothbrushing, it is a very elusive goal.
Yeah, I mean, here amongst these conversations, when we talk about solutions, sometimes they're very expensive, and this is something that is quite accessible. And so, Greg, bringing you in, and Stephen talked about the sheer mass of oral health challenges that are out there, but it's also very directly linked to other NCDs like diabetes and heart disease. Yet oral care is very siloed in a lot of these conversations. So why is that, and how do you see self-care being a strategy to help bridge that gap?
Yeah, thank you. I think one of the key issues, I think in general, self-care itself is probably undervalued in its contribution to public health issues, particularly around NCDs. And I think there is a change now. I think there's a greater understanding that self-care can not only be better for the patient, or not the patient, the person, because in a lot of cases in prevention, we want people to remain healthy and not become a patient. But I think also it's part of the growing concept around the importance of prevention before treatment. And we know in the global health community, there is a refocusing from treatment to prevention. So I think the oral health, and I have to say, even myself personally, you know, I've been in the public health area from many years, from generics to running an access foundation to working in the R&D industry. The oral health has always been the sort of the junior issue, sometimes forgotten issue. Now, I think to address that, I think we've got to think of it from three sides. First, awareness. I don't think Joe Public, if I use that term, is that aware of the link between bad oral health and the whole series of other diseases that, you know, we're talking about. I think if you go out on the street today and have an interview with people and you say, well, what do you think about your tooth decay? I say, yeah, well, yeah, it's painful, I've got to go and see a dentist. But you start saying, did you know it has effect on diabetes, obesity, etc., even infertility? They'll go, well, I never thought of that. Yeah? And I think
it's not a vanity issue.
It's not. So I think that's one thing, is getting the message across to the public. And I'm not an expert, but there's loads of ways in which that can be done. The second thing is more, I would say, at the healthcare community and private sector level. I mean, there are a lot of community initiatives that you can see around the world which are trying to promote the use of fluoride toothpaste, brushing, from Nigeria, where there's been recent interventions of trying to promote greater fluoride, to, I just heard today, the new government in the UK is now reintroducing the concept of learning how to brush your teeth at school. It's a sad fact that we've got to go and do that, yeah? And I think there's also the work of companies, from, you know, what they're doing in, you know, research and development, new innovations, making people aware, but also a lot of issues like I heard the other day about, you know, contributing donations, yeah, to, you know, let's say poverty-stricken areas that require activity. And then the third, which we're going to talk about later, is the political class, the people that we engage with, yeah, and the need to get them to understand that link. And it's not just the health ministers. We have this discussion all the time. It's the finance ministers. If they click, oh yeah, okay, I only have to invest this amount of money, and actually the result is this, that has an effect on finance ministers, and they're all trying to find a way to do things. But again, it's also, as I just stressed, it is a great example of superb self-care interventions, is oral health. And, you know, if it's done properly, you're going to free up a lot of primary health care. a lot of visits to dentists, which people don't do that often.
I like that. Yeah, you need to go after the purse strings too. So, Stephen, Greg mentioned the research and development innovation that you do at Haleon. Obviously, you can play a role in providing products, but also being able to share some of that research. And even beyond self-care, where are you seeing the opportunities for advancing oral health, and particularly low middle income countries?
Well, I could spend an hour answering that question, probably longer actually. But at Haleon, we're dedicated to empowering millions of people each year to access better everyday health opportunities, and obviously with a special focus on oral health. I mean, I'm not a dentist. I'm a hardcore scientist researcher, but I've fallen into oral health, and I've got the bug, and the bug for public health as well. And we're committed to uncovering insights and create actions that drive the health inclusivity forward. And I'll just pick one example. Last week, we launched the third phase of our Health Inclusivity Index work in partnership with Economist Impact. And for those unfamiliar with the index, it's about gathering evidence and insights to drive greater action around self-care and health inclusivity. And phase one was in 2022 was a snapshot of inclusive self-care health globally, analysing policies, strategies, infrastructure, and programs across 40 countries to determine how we can support and drive health inclusivity. The second phase in 2023 built on this and captured insights and around the lived experience of consumers or public in the self-care world. And this newly launched third phase has modelled and quantified health and economic impact of various common health topics, with a particular focus on underserved groups, people with low health literacy, those with low incomes, women, individuals over 50, et cetera, et cetera. And there were two oral health topics in that modelling, and really what they just, in some respects, confirm what we know already, or provide some hard data. Inadequate preventative dental care and high disease prevalence means that the treatment costs are 50% higher for people on low incomes across the 40 studies. That's the socially patterned nature of the disease. But targeted health promotion should be able to reduce the lifetime dental costs of the lowest income group by maybe as much as $12,000 US dollars a person, and the greatest saving would actually be in the US. And those savings might extend beyond oral health. If we can encourage the professional periodontal care and then the maintenance of good oral hygiene, we can do something about diabetes and potentially boost economies by, or the model says that we could boost economies by 180 billion over 10 years and reduce healthcare costs and productivity, which is what Greg just said, I think. This is just something that Haleon can do and tries to do to broaden the discussion and promote it.
And so, we're here on the sidelines of World Health Assembly, and Greg, you were a signatory to a recent open letter to policymakers to really recognize self-care as a vital part of the fight against NCDs. So what do you think can be done to make sure oral health is part of that conversation, and what are you hoping to see happen this week?
Okay, well, first of all, I think like everybody in the room was quite knocked out when oral health was not in the zero draft. And I was reading an article and it didn't reference, and I said, well, it must be in...
A typo?
It must be a typo, yeah, I just thought they haven't covered it. So then I went into the main thing and I read all through and I said, I don't get this. Self-care is not explicitly in there as well. That wasn't such a shock at this time. I'll come back to that. But the oral health care, I just couldn't believe it. And I think, everybody in this room knows very well we've got to reach out to a number of member states to get that in there. The question is why? Why? Because I think it's still looking back to 2018 and trying to build on what is on there, and oral health care isn't in there, but I think things have moved on. And it relates to, you know, the issues of obesity and tobacco cessation. They're all linked. And for example, tobacco cessation is important for oral health as well. So yeah, we know that as a group here, we have to reach out to a specific number of member states to get that put into the zero draft. In addition, I think, and we're working on that well, and we appreciate any support from colleagues here, we would like to have also specific reference to self-care. Because, you know, if you don't have self-care, and this is one of the greatest examples of self-care, together with tobacco cessation, it's a major missed opportunity, because through providing tools for self-care, like in the oral health, tobacco cessation, you're going to be able to deal with some of the key problems right up front. Easy access, easy applicability. You can walk into a pharmacy.
At a lower cost, too.
At a lower cost. Walk into a pharmacist, you can get your tobacco cessation, you can get your toothpaste, you can get your, I can't use the brand name, mouthwash, nearly did. Yeah, and immediate. You're in, you have access, you start working it, it's high impact. Then if we can do more of this in other areas, look, sunblocker is another great example. How much primary health care can you then leverage up, yeah, for other issues where you can't maybe have self-care as the issues? For example, NCDs and rare diseases or something. That's nothing to do with the way you live or whatever. So I think that's very important, is to look at this twin dynamism between the self-care side, which covers oral health care, and freeing up the primary healthcare for the other sides of NCDs, which will need more, maybe higher level specialist treatment.
Well, Stephen, Greg, thank you so much. And we will be continuing this conversation in our next panel, but join me in giving them a round of applause. Thank you.
Thank you, guys. Thank you. Thank you, Kate.
So I welcome onto the stage my colleague Rumbi Chikamba, senior editor at Devex, who will continue the conversation, really looking at how we can put these strategies into action. So Rumbi, over to you.
Thanks, Kate, for setting the stage, and please also help me in welcoming our next group of panelists. We have Katie Dane, who's the CEO of the NCD Alliance. We have Nupur Lalvani. Please come out. We have Nupur Lalvani, who's the founder director of the Blue Circles Diabetes Foundation. We have Professor Manu Matu. Please come on, everyone. We have Professor Manu Matu, who is the professor and the head of the Center for Dental Public Health and Primary Care at the Queen Mary University of London. And then last but not least, we have Benoit Varane, who's the Global Oral Health Lead for WHO. Thank you all for joining me. And Benoit, I am going to start with you because it's WHA and you're from WHO. So we've heard a lot about oral disease and how it's sort of the forgotten child in the NCD discussion. So oral diseases and other major NCDs share common risk factors, yet oral health is often left out. We've heard that it's been left out of the zero draft on NCDs. How can countries better integrate oral health in their broader NCD frameworks?
Thank you. Thank you for the question. So of course we have been working now for a number of years, you know, to improve this integration of oral health, oral disease as part of NCD framework. So there is a strong commitment from a number of member states to move on that. They gave a strong mandate to WHO to develop a global strategy, action plans, and additional report. So I think we have more or less all the policy options, you know, available now, and a number of solutions also to move forward. And there is a lot of countries already, you know, engaged on this framework. After that, if we are talking more here about prevention and integration, I think there are several aspects that we have to talk about. The first things probably it's interprofessional also integration, to ensure that this work on prevention of oral disease is not only the job of dentists and specialists, but really across the NCD spectrum. The second thing is there is some cost-effective intervention, available also to ensure that we can arrest, we can prevent dental caries, with the main, of course, burden in terms of oral disease. We have also to talk seriously about commercial determinant of health and long-term partnership with private sectors. So it's all this aspect that should be definitely discussed, by government with the support of partners. And Steve, I think, mentioned the Global Coalition for Oral Health. So there is also now a strong will, to work together, including private sectors, academic, researcher, NGOs, people also affected and living with some oral health conditions. So I think all the things are there, and we just need to move, to support as WHO, of course, to ensure that, the reforms and the different intervention we need also this balance of what we call upstream, middle stream, and downstream intervention. So we need strong policy measures for regulation. Sugar is definitely our common enemy for NCDs, unhealthy diet. At middle level intervention, of course, need to work at different settings, education level, school, workplace. There is a lot of things to do, and of course downstream, health literacy, awareness campaign is definitely key to ensure that people could just make the good choices, in terms of number of aspects related to this. But again, tobacco, unhealthy alcohol use, unhealthy diet, and in addition, of course, fluoride is definitely an option, to ensure that we are effective in terms of prevention. So there is a number of aspects that could be definitely implemented now in countries.
Thank you so much. Katie, I want to jump to you. Why do you think oral health is often neglected, and how can civil society sort of champion it? And I think this is really important right now when we're talking about that zero draft.
Sure, thank you. Thank you for the question. And I think, as others have already highlighted, I think we're seeing that blind spot very recognised within that zero draft of the political declaration, the fact that oral health isn't included in it. The why of that, I think Greg touched upon it earlier in the fireside chat in terms of one of the points, the fact that perhaps the broader NCD community hasn't recognised the fact that oral health is not only important for its own specific, condition, but also the interconnections between all of the other, so many of the other NCDs. So it's that kind of center of a web of non-communicable diseases that is important. But I'd say that the other reason perhaps is that in the NCD response, the NCD agenda over the last 15 or so years, there's obviously been a very strong focus on mortality, and particularly premature mortality. That has been the driver of why the big four diseases were prioritised back in 2011 and WHO's 4x4 framework, obviously mental health now being added. But the morbidity aspect of NCDs, which is obviously where oral health comes in, is so important as well. We know that NCDs are the number one driver of morbidity worldwide, oral health being a significant component of that. So I think kind of recognising that the NCD agenda needs to look at both mortality and premature mortality specifically, but also morbidity is an important aspect. Going to kind of the second part of the question of what can be done. I don't think you can really fault this man and so many people in this room about what's happened within the oral health space globally over the last 3 to 4 years. I think everything that should have been done has been done in terms of the resolution in 2021, the strategy and the action plan, global targets on oral health, the best buys. These are all the steps that we recognise that we've seen in the NCD space have been really valuable in putting the broader NCD agenda on the map. And obviously the Bangkok meeting at the end of last year being another important part of that. So I think what can be done is really building on all of the fantastic technical work that's happened on NCDs at the global level to be recognising that in the declaration, right? I don't understand why in the current declaration there is no recognition of the Bangkok Declaration, along with some of the other preparatory meetings that took place over the last few years, whether that's financing, humanitarian settings, as well as another one that my brain has completely forgotten. But it's important that the document is recognising what's happened over the last 7 years, and the Bangkok meeting and all of the technical work that's happened is an important component. I would say another thing that Benoit just touched upon is, how do we get things in that zero draft and obviously the iterations that will follow? This is obviously a member state-led process, but we saw in 2011, it really takes one government to be putting their hand up and saying oral health has to be an important priority. I think in 2011, it was Tanzania that was really the government that was putting oral health within that declaration. So we need to make sure that we're working with governments, that we're working with champions, to make sure that we've got strong language, oral health. But also, I think the other point from our side is we all need to see ourselves in that document in terms of oral health, kidney disease, sensory, neurological, wherever you're coming from. It's a broad agenda. We all recognise that. But also, I would say it's important that the oral health community, and I know that this is being done, is also really kind of strengthening and supporting those broader cross-cutting aspects of the declaration that will be supporting your issue. Benoit was flagging things like commercial determinants of health, primary prevention, tackling the risk factors that will obviously improve oral conditions, as well as that paragraph on health systems in terms of that shift to primary healthcare, universal health coverage. So ensuring both the disease-specific aspects are recognised, but also the cross-cutting elements of the declaration that can support your area.
Yeah. And Nupur, over to you. From the perspective of people who actually have NCDs or live with NCDs, what are the biggest gaps in the current oral health strategies, and how can we be more responsive to their voices and their lived realities?
Thank you, Rumbi. It's a pleasure to be here and, picking up on what Kate said in the fireside chat about oral health being really siloed. There's a lack of health systems being people-centered, and we say this all the time, but it's not just somebody's teeth, or it's not just a kidney, but it's the whole person that needs help and support and treatment. But there are several factors that are barriers in terms of people receiving the help they need, and one big one, and I know this has come up, is the lack of awareness. And both Benoit and Katie also touched upon the prevention aspect, and I think we need to start early on. There was a mention of schools teaching children how to brush. I want to quickly add here, I had the honor of participating at the WHO oral health meeting in Bangkok late last year, and that got me thinking. So I run a community of people that live with diabetes. However, so we go to schools and we conduct programs on diabetes awareness for underserved students and their parents as well. What I've started doing after Bangkok, after the meeting, I didn't tell you this, Benoit, but we've also added in a little bit about oral health. It just takes that one little bit of effort. So we tell children about how it's important not to have sugar sweetened beverages or junk food, and that also helps their teeth.
I wish someone had told me that, because I have a sweet tooth.
So lack of awareness is something that's a big problem. And then the other real problem, and that's always been there for a lot of us, especially from low and middle income countries, is the financial constraint of developing oral disease. A lot of the times it's not covered under insurance. It's not effectively embedded in the primary health systems. So we also need better integration into PHC. We need better integration into universal health coverage. Oral disease does not exist in vacuum. It exists along with a lot of other things. And I think that effectively integrating it, and I know that this came up earlier as well, that it's oral health is one of the newer and most junior parts in the NCD discourse. But I think it's time for the oral health community to really collaborate and integrate with all of the other areas that come in. Also, I think there's perhaps a lack of trained healthcare professionals where people need it, and there's also a lot of stigma around oral health conditions. Thank you.
Yeah. And Manu, we've been talking a lot about like integration into the primary healthcare system. And you've done like extensive research on the intersection of oral health and public health and public policy. What are some of the critical barriers to implementing oral health strategies within the primary healthcare systems, particularly in low and middle income countries?
Okay, Rumbi, thank you for that question. Morning, everyone. Morning, esteemed panel. Uh, well, I have not done much research and I have failed in whatever I've done on integration. Let me accept it. But I would like to tell you that all these failures have led me to understand one thing, that we need to go into history and we need to read our documents properly in order to understand what are the barriers for integration. I would like to quote two instances here. The first one is the primary health, the Alma Ata Declaration, which came up in the late 1970s. It defines primary care very, very well. And I would like to read it out. I can't read it out because we have been told not to carry papers. But basically, what it says is that it is a set of essential health services which are scientifically proven, socially acceptable, practical, and which can be delivered along with the community at a cost which is very low and is not dependent upon a lot of resources. So even if there are economic pressures, the services continue. I think when we talk about integration into primary healthcare, we forget about this basic definition of primary healthcare. Sorry for sounding a bit critical. And that is where the oral health strategic action plan, and if you see the global movement around what has happened in the last 3 years, the focus has moved towards prevention, focus has moved towards frugal innovation, focus has moved towards low cost innovations. Because if you have this extensive elaborate thing in mind that okay, I'm going at a primary healthcare level and I'm going to do this, it's not going to happen. And especially if you're talking about low and middle income countries, one from where I come, and I think 80% of the world's population come from there, it will not happen. So first thing is we need to read what exactly is primary healthcare. What are we trying to integrate? And then we can talk about functional, operational, and all these service integration and all these things. And the second thing is, we also have to understand how health systems are developing in these countries. Post-colonialism, what has happened is that the major problems which countries like where I come from encountered was IMRs and MMRs. Life expectancy was low. So the health system was constructed to take care of these problems. There were vertical systems or programs which were developed to take care of these systems. They have been going on for the past 70, 75 years. They're well established. If you want to do something, you have to understand how these programs are run and you have to integrate yourself into these programs. What we are doing is we are saying that, okay, we have developed a fantastic manual. Let's go and train the nurses to do that. Well, a nurse has studied for 5 years in a discipline oriented way. They are trained to do something for 4, 5 or 3 years, whatever it is. Now, suddenly you go with a manual and say that now from tomorrow you start doing oral health care. Integrate. That's not integration. So you have to understand how these health systems are developed and then you have to work. And this leads to funding. That's the most important part. We have been talking about economics and all these things. Well, you have to understand that when you're fighting for limited resources, you cannot say that, okay, I need another parallel system and I need my resources there. People will not spend their resources on you. Who are you to tell me? This does not concern me. This is out of my purview. I have many other indicators to report to. These are the answers you will get. Who are you to tell me? These are the answers you will get. But I think these are the most important things which we have to keep in mind when we are doing this, that when understand what primary healthcare is, first of all, develop these low cost innovations, and then I think talk about integration and moving it further. I think these are the most important things. Sorry if I've run over time.
No. We're still doing good on time, but I'm going to take a moment here to take a break from asking questions and have like 2 audience questions. But I'm very selfish with my panelists, so I'm going to ask that we keep the questions short. First, from Dr. Greg Chadwick, who is the president of the World's Dental Federation. Greg.
I just speak from here. Thank you. Speaking on behalf of FDI, advocacy is really at the heart of our mission. We champion the integration of oral health into the UHC and NCD agendas. While decades of advocacy have delivered meaningful progress, major challenges still remain. Alarmingly, as we all know, we're absent from the zero draft at this point here. Despite the clear evidence and growing political will, oral health again risks being left behind. So we were asked to ask a provocative question. So, as the most prevalent NCD, oral disease is the most prevalent NCD, sharing common risk factors, social and commercial determinants of health. How do we get others across the NCD spectrum, especially the big 4 or 5, to include oral health as a significant priority that should be integrated and addressed in their work and conversation as we do? If we can't get our NCD colleagues to routinely embrace us in their agendas, how do we get the larger healthcare community to recognize oral health?
Thank you so much, Greg. Next question we're going to take from Deepna Kavanagh, who's the Chief Dental Officer from Ireland.
Thank you very much. And I would like to raise a provocative question, in some ways a contradiction to Greg's, but I work in oral health policy, not just in Ireland, but I also work across Europe with, indeed, as Steve mentioned, the Platform for Better Oral Health. And one of our aims is, as we say, to integrate into other policies and to work with other healthcare professionals, because we feel they can carry our message, just as was pointed out earlier on, because so much of oral health is integrated with diabetes, with physicians, with community nurses and others. However, what I would raise is we're always asking others to do things for us. And I wonder, is there something to say that we are not offering our services in general healthcare, such as providing simple blood pressure checks or looking at other areas of health and health advice that we can provide? And accepting that we have a reduced capacity in our workforce, but all of these other areas have a reduced capacity as well. So yeah, provocatively, I'm saying, are we always the takers and not the givers? And what do you think of that? Thank you.
Love those questions. Love a bunch of provocative questions. Benoit, I think I'm going to start with you. So how do we make sure that the big 4 also include oral health?
I think it's a key aspect, and I think we started to answer to this question. But again, what it's interesting, of course, it's to discuss at country level what could happen, because we have to show that this integrated approach could be effective. And so, of course, there is a big effort from, of course, oral health community, but other diabetes experts, cardiovascular, cancer, and chronic respiratory disease, to make some effort to move out from, the silo, that existing silo that we know that is the case in most of the countries, and bring together, some element, to work together, but also to bring, of course, civil society, to bring also private sector. I would like to insist a bit on that because this session is supported by one of the business associations also, and to really work together on, again, long-term, partnership, because so many times, in countries, member states, Ministry of Health could receive some donation, and toothpaste and things like this. Definitely it's not enough. We have to move to a much more public-private partnership, working on transforming the food environment, working on sugar again, because we mentioned that, and we agree, I think that there is some cost-effective intervention at PHC level, NCD platform, that could be important. But if we are not tackling, the sugar, because we can focus a bit on sugar because it's also diabetes, obesity, dental caries, will never, inverse the trend of this burden. So there is a lot of work to sit all together, again, government, civil society, academic researcher, private sector, to find a way to tackle this sugar issue intake, because this is the most of the important aspect, I think.
Thank you. Katie, same question.
Sure, it's a difficult question, isn't it? I mean, I think FDI is doing a great job of doing exactly what you're asking, Greg, in terms of actually linking oral health into the Big Four and into the NCD agenda. I mean, from an NCD Alliance perspective, we for a long time have taken what we call a kind of 5x5+ approach, right? Recognizing the big 5 diseases, but also recognizing a whole range of other important conditions that are part of the NCD agenda, including oral health. We don't always necessarily get it completely right, appreciate that, but that's the strategy and that's the focus, and that's what we're taking into this high-level meeting. I think in terms of the other big disease groups, obviously many of them are kind of founding members. I think it goes back to that point of, what is the framing of oral health within the NCD agenda, and what's the evidence being used to make the diabetes, cancer, cardiovascular community wake up to the links. And I think it's that kind of putting oral health within that web, making it clear that by investing in oral health, you're having a multiplier effect on these other diseases. And I do think the economic arguments are important, making that investment case really, really clearly. I would also say in terms of the kind of the framing, I know we've talked about this a lot within oral health over the years, but I do think, epidemiological, economic data is important in making the case. But there's also the kind of the lived experience angle that Nupur brings to the panel, which is important. We've talked about this a lot, but there hasn't been that really strong kind of patient lived experience voice within oral health. I think we're seeing that across the NCD agenda as a whole. And I think that's another way of making common cause, that people having, experienced oral conditions, oral health diseases, to be talking more about that and the links. So it's coming from a people and a lived experience perspective, as well as the data and the evidence talking the talk as well, as it were.
And then Nupur, do you think the oral health community should be doing more? Are they just takers and not givers right now?
I was just thinking about that to your question as well. What can people with lived experience do? Patients are usually just the beneficiaries of care, and, we are passive recipients. But, things really change when communities are involved from day one. Like Katie was saying, right from conception to finally to monitoring and evaluation. When people have a say in their own health and about what goes on with their bodies, I think there's potential for success. And I think that, Katie was mentioning the 5x5+, so I think oral health definitely needs integration into the NCD framework, whether it's 5x5+ or a 6x6. And also, it's very important to highlight the risk factors. And I know that we've been talking about how the zero draft doesn't include a mention of oral health, but I do want to point out that there is a target of 80%, I believe, reduction in, tobacco and alcohol and sugar sweetened beverages taxes, countries to have to tax these things. So that seems like a pretty pragmatic, call to action. And what remains to be seen is how, countries implement this. And also, I think what we can do as people is to we sometimes don't realize the power we have, to demand political commitment to the cause. I heard of some fabulous examples while in Bangkok, the 30 baht clinic, that Thailand has. So even for a middle income country, if they're able to have affordable healthcare, and include dental care as part of the UHC packages, I think it's fabulous and successful. And I think that's a success story to be shared with other member states as well.
Thank you so much. And Manu, same question.
Takers and givers or the NCD integration?
Takers and givers.
Takers and
Do you want to switch questions?
No, that's fine. That's fine. Dimna, fantastic question. I think the answer is 3 points. First of all, we have to set our house in order. There are 3 things which we have to do first in order to be a giver there. So that all these different NCD or the development conditions also start thinking, that yes, this is important. Yes, this should be a part of us. Yes, this should be integrated. And first thing is the outrage factor. We have to create an outrage, whether it is through a people's movement, whether it is through a professional body movement, whatever it is. But we need to create an outrage. Yes, this is important. This cannot be done by just preaching. There are things which needs to be done on ground. This is as important as any other disease condition of the body. There should be a clear outrage which should come, and not, I mean, I would say that yes, we are reaching there, but we still do not have a cohesive voice. The second thing is we need to have clear demands. If we want to be a giver, we need to have clear demands that what we expect out of this. If we are giving you this, what we expect out of this, or what exactly is it that is the basis of this partnership or basis of this relationship. And the third important thing is that we need to be seen as an active part of coalitions, and not only just be a member or somewhere. We have to be an active part of a coalition. We should be seen as active members contributing to the cause. There are a lot of things which are happening globally. Where are the leaders in oral health which are actually leading some of these things? I mean, we are very fortunate we have Benwa with us. Strategic action plan. We have this strategic action plan, which I think is a very important tool, and I think it's a very successful advocacy tool. But we need more leaders like this who can speak the language. If Katie allows me to say this, but if we look at all this, the movement to 2011 UN high-level meeting on NCDs, what happened before that was a very successful movement, not only through the civil society, but also through the academia. So it was not only the high-level declaration on NCDs, but some of the seminal papers which came with it. Like if you lead to a reduction of 25% use of tobacco, the cardiovascular diseases will fall by 25%. That makes an impact. They had visionaries, they had leaders in place who actually took the message, converted into action, and showed the world that yes, this has to be done. So outrage factor, clear demands, building coalitions, and building leaders within our fraternity who can really take the message forward. I think that would be the. Thank you.
Thank you so much. And in 1 minute now, I want to ask all of you, looking ahead to the UN high-level meetings, what do you consider the most urgently needed action to ensure that oral health is included? I'll start with you, Katie.
I'll say 3 things very quickly. So I think from our perspective, there needs to be a paragraph in the declaration that is recognising the beyond 5, including oral health, including kidney, including sensory, neurological, you name it. Everyone needs to see themselves in the document, and I think that's how we can achieve it. Number 2, there needs to be recognition, as I've said, of the Bangkok Declaration and what's come before in terms of the political momentum and the technical work. So I think Bangkok Declaration has to be in there. And then number 3, as Benoit was saying earlier, there's so much within the rest of the document that will be supporting acceleration of progress on oral health. Health taxes, as Nupur says. Increasing health taxes on sugar-sweetened beverages will have a huge impact upon oral conditions and oral health. So really supporting the bits within the declaration that are obviously kind of cross-cutting and are going to amplify and support progress on oral health as well.
Not sure how I feel about you guys taxing my chocolates, but Benoit?
Yes, so I think there is a very concrete action, that each member state who are convinced about the importance of oral disease as part of this big NC agenda, they have to send an email to the New York Permanent Mission, and ensuring that, yes, there is a good narrative. And this narrative, as we, I think, all agree, is just not to add another disease on the already long list, but really to find a nice way to to present this addition, as a real contribution, not only to, of course, the improving oral health, but also definitely to contribute to reduce the other risk factors, because we have discussed a lot about this prevention, but also as part of the, the primary healthcare approach, and trying to convince, the people that having a bit holistic, approach regarding NCD for the people, for the patient, it could make a huge difference.
Thank you so much. And Nupur?
I think embedding oral healthcare in primary healthcare and then by effect in universal health coverage, that would be a great thing. And also health financing for oral health, without which, not much progress can be made. And finally, also, putting targets to it, because unless there are targets, we don't know the progress we've made.
Thank you. That was nice and short. Manu?
I'll try to beat Nupur here. But everything has been said. I think the gold standard would be what Katie said. Best buys would be what Benoit was mentioning, finding opportunities. Gold standard, what Katie said, having a paragraph, best buys, finding opportunities within the declaration. And if I take a pessimistic approach to this, well, there are other things which are there. We have the strategic action plan with us. We have the Bangkok Declaration with us. And we should not forget that the UN Declaration on Universal Health Coverage mentions oral health. So if UHC is the global goal, it's the global policy goal, and in the United Nations Declaration, oral health is already mentioned. So why not leverage on that? So let's not be pessimistic. We should try our best to get it included. If not, our ordeal will continue, and I think we have opportunities.
Thank you. We'll definitely be following your work and work to get this included in the zero draft as Devex. But thank you everyone for joining me. I'm going to hand back to Kate.
Thank you, Rumbi. And yeah, thank you, everyone. I think those conversations really laid out to bear why investing in oral health is so critical to combating NCDs and UHC, and making the case for it this week at WHA, and then looking ahead at the high-level meetings in the UN in September. So I just want to thank you all for joining us, and thank you to Haleon for partnering with us on this really important conversation. I'm so glad we're able to bring this as part of our series of events focusing on NCDs this morning. And thank you to those of you who joined online. We will be continuing the day with some more events, so you are welcome to stay, including a lunch. But for now, thank you all for joining. Thanks.